Over the past few years, every leader of a healthcare organization in the country has had to acknowledge the threat of a cyber attack that has the potential to compromise systems and patient safety. Welcome to Advancing Health, a podcast coming to you this week from the American Hospital Association's annual membership meeting in Washington, D.C. I'm Tom Hitterly with AHA Communications. In this podcast, John Riggi, AHA's National Advisor for Cybersecurity and Risk, is speaking with former AHA Board Chair Brian Gragnolati, President and CEO of Atlantic Health System, about best practices for care providers to avoid, plan for, or mitigate cyber threats.
Brian, I've had the opportunity to work with you and your outstanding executive leadership and information security teams for the last several years. As you know, I've also had the opportunity to interact and engage with thousands of hospitals and health systems across the country. And I can honestly say that Atlantic Health System has one of the most progressive and advanced information security programs in the country, which is developed under your leadership. As CEO of Atlantic Health System, how have you enabled that exemplary cybersecurity posture?
Well, John, thanks for those kind comments. I don't think it's ever enough. So we're working really hard. I think as a CEO, what you need to do is, one, identify this as a top priority. Once you do that, you got to make sure you have the right leadership in place and that leadership has the necessary resources in order to accomplish what they need to accomplish. But the other thing that you have to do is constantly talk about this. And so in most of our leadership meetings and at our board meetings, we talk about the importance of cybersecurity. We talk about the threats that are ever growing. And I keep beating that drum. It is indeed the top priority in our organization as it relates to non-patient care activities. But ultimately, if this is not done right, it will impact patient care.
Exactly. And it's interesting, as you said, it's never one simple message. It's not like, check the box, oh, we covered that, let's move on to the next issue. It's a constant threat, which needs constant reinforcement to the staff and to the leadership. Brian, what is the biggest concern you have regarding the potential impact of a disruptive cyber attack, such as ransomware?
The way we always sort out priorities in our organization we ask three simple questions. How does this affect our patients? How does this affect our team members? And how does this affect our numbers? This is an issue that goes across all three, but my biggest concern is the impact on patient care.
That's exactly right. I think years ago, folks would think about cyber risk and they said, oh, that's just an IT issue. And unfortunately, as we've seen through these high impact, highly disruptive ransomware attacks, immediately the first issue of risk is on patient care. But it starts with this technically complex threat. So how are those technical threats translated, if you will, to you so you can understand them from a strategic perspective and understand which ones may pose the most probable and serious impact to Atlantic Health System?
You know, John, we have to rely on a number of resources, and the work that you're doing with our hospital has been nothing short of incredible. And that really helps me as a leader be able to try to simplify what is an incredibly complex issue. But as I look at it, what I think about is that we have systems that connect everything. And those systems have a lot of feeds that go into it. And so in a very simple way, we've got to look at anything that interacts with either our devices or our information technology systems as a vulnerability. And I could get mired in all of the iterations and all of the variations of this. But at the end of the day, this is a virus or a disease that you do not want to infect your organization. Therefore, you have to do things that make common sense. Like you've got to segment parts of the system. You've got to make sure that the people that you're working with take protection as seriously as you do. And then I have to just let the technical people do what they do. because they know what they're doing. And then I've got to just make sure that they've got the resources that they need in order to do this.
Right. So that's a great and very astute comparison, comparing the digital viruses to the biological viruses we face. And in a sense, the digital virus that spreads ransomware or malware is akin to a biological virus. So things that come in contact with it can be contaminated. And ultimately, I think, and certainly under your leadership, I've seen this personally, staff understand that cyber hygiene is as important as medical hygiene to protect the patients. So Brian, as you just stated, so you well know that cyber risk poses a risk to every function in the organization, including all the business and clinical functions. In my dealing with your leadership and staff across all functions at Atlantic, they all seem to understand this in that they personally have a role in preventing cyber attacks to protect the organization and, most importantly, to protect the patients. What have you done as the CEO, the leader of Atlantic Health System, to instill this really, truly admirable culture of cybersecurity?
You know, again, making this a priority is the first thing. I talk about it a lot. Our team talks about it a lot. The second thing that we've tried to describe is why those vulnerabilities exist. And probably the clearest way to describe this is we get millions of attacks a day. Millions of attacks. All it takes is one click on our side to infect the system. And the clarity of that, I think, creates an awareness. But we also trust but verify. And we make sure that we're constantly testing. Our phishing exercises, which we've done for the last several years, are always interesting. And I think that alone has heightened people's awareness. And then we use a lot of the techniques that you've suggested to us to make sure that people don't get fatigue over this issue and that they stay ever vigilant on this because, again, the attacks are just incredible.
They are. And I think I've heard your Chief Information Officer, truly a talented individual, Sunil Dadlani, and your Head of Information Security, Larry Pierce, talk about how the thousands, millions of attacks that they have and they deflect every day. Mm-hmm. And they always say this, right? The bad guy can be wrong 99% of the time, right? They only have to be right once. But your team, your defenses have to be right every time. So, Brian, clearly you understand that cyber risk is an enterprise risk issue. Just wondering, do you formally rank cyber risk as an enterprise risk issue? And if so, what ranking number do you assign it?
So we do. As part of our enterprise risk planning process, cyber is the top issue.
Thanks for that, Brian. And that I think demonstrates the magnitude of the threat that we're facing, even during a pandemic, even during workforce major shortage issues. We have Brian, one of the most significant CEOs in the country of a health system, talking about ranking cyber risk as their number one risk issue. Brian, in terms of cybersecurity risk, really following up with you on that, two-part question. What most keeps you up at night? And what are you most proud of in terms of what you and Atlantic Health System have done to mitigate that cyber risk?
What keeps me up at night is not knowing what we don't know and making sure that we're always staying on our toes and doing everything we can. The thing that in this area makes me really comforted is that I know we have the right leadership in place. I know that we are using as many advanced technologies as we can use, and we are constantly moving forward in that direction. That we're also getting expert advice. Again, I can't talk enough about the help that you've provided to us and many other hospitals and health systems in this country. And this is a team effort. You know, at Atlantic, we pride ourselves on One Atlantic in that we approach things in a team way, whether it's patient care or issues like this. And indeed, I think we have a very engaged workforce, and that really gives me assurance that although bad things could happen, we're doing everything we can to keep that from impacting patient care.
Thanks so much, Brian. One, personally, thank you for the very kind words. It's always great to work with you and your team. And thank you for your leadership. Thank you for your leadership. Thank you and all the men and women of Atlantic Health System for what they do every day to care for our patients and protect our communities. Thank you.
Thank you, John.